For this lesson, it's optional to use 3 pillows, especially if you're having any pain or discomfort. These might come in handy. So go ahead and grab a mat, or you could just lay down on the carpet. And we're going to start laying down on your back. Now, you won't need the pillow for right now, but if you're having any low back discomfort, I always recommend putting a bolster or a couple pillows under your knee to support your low back. This helps your low back to come closer to the ground. So go ahead and set yourself up comfortably. And we always begin with a body scan. So just notice how your body is making contact with the floor. Which parts are more raised up from the floor, and which parts are contacting the floor. Let's focus first on your shoulder blade. Let's look at your right shoulder blade. What's the shape of the right shoulder blade? And how much pressure is that making into the ground? And how about the left shoulder blade? What's the difference? Is one heavier into the ground than the other? Which part of your ribs are making more contact with the ground? Is it more the right side or the left side? And is one side of your pelvis more in contact with the ground than the other? So in Feldenkrais, we want to pay attention to differences and shifts that happen throughout the lesson. Notice which way your nose is pointed. Notice which way your eyes are pointed. Are they more to the right? Or are they more to the left? Or are they more or less in the center? Perhaps go ahead and roll your head once to the right. Come back to the center and once to the left. And what's the difference? Is it easier to roll to the right? Or is it easier to roll to the left? And everything with Feldenkrais, we want to do easy, effortless, and slow. Staying in your range of comfort and ease. So that means when you go to roll your head, then you just want to go however far is comfortable, even if it's only a few degrees. Notice how your breath is. Notice where your breath is. And pretend like you're lying on a balance beam, and the balance beam is lined up with your spine. Would you fall to the right of the balance beam? Or would you fall more to the left of the balance beam? And is there anywhere in your body you're holding, like holding muscles? And sometimes we're unaware that we're holding muscles until we actually have the experience of releasing the hold, which hopefully you'll experience throughout this lesson. So go ahead and lie on your right side. And if it's uncomfortable to lie on your right side, then you could start on your left side and just reverse my rights and my lefts. And so we're going to start by setting ourselves up with our arms and legs at about an 80 to 90 degree angle stacked on one another. What this means is a 90-degree angle would be a square or the corner of a square. If it's uncomfortable in your arms, or if you have any shoulder pain, then maybe take your arms down a tiny bit. And we're going to start by sliding your upper hand, so your left hand, forward on the lower one. But we're going to go super slow in a very small range. And so relaxing your hand, making sure your fingers are curled as opposed to straight. Very gently elongate your left arm, slide it forward on the right, going just about a millimeter or 2 or an inch, and then slide it back to the start. So just a tiny bit, especially the first few you do. As you continue to do more repetitions, you could go a little bit further, but the first few, always make them very small. With Feldenkrais, we want to do everything with as much ease as possible. So make sure you're avoiding using any excess muscle tension, such as contracting your jaw or your shoulders. See how easy you can make this movement. Go very small, sliding your upper arm forward and then back to the start. Do this in a way like you're caressing your lower hand. Feel the texture of your skin. What does it feel like? And also notice what's happening in your shoulder blade. Is your shoulder blade moving away from your spine? Does it move back towards your spine? Do this 1 or 2 more times. Okay, take a pause, just take a rest, take a breath. And now we're going to gently slide the left arm in the opposite direction. So take it 1 millimeter or 1 inch in the direction towards the heel of your right hand, towards your body. Then exhale and release. If you want, you could coordinate this with your breathing, the inhales and the exhales to avoid holding your breath. Go nice and small, nice and slow. As it gets easier, you could go a little bit further. Notice what's happening in your shoulder blade as you do this movement. Pause for a moment. Take a breath. And we're going to do the same movement of sliding your left arm backwards. Yet this time we're going to coordinate it with the movement of your head and neck. So the next time you slide your left arm backwards in the direction of your body, go ahead and roll your head to the left. And then bring it very gently back to the center. Now, did you push your head and neck? Did you feel any tension in your head or neck? Or did you go light and easy? Go ahead and do it again, sliding your left arm fingers backwards, allowing your nose to roll in the direction of the ceiling. Exhale, release. Do this a few more times. You could do it with your eyes open or closed. I always like to do it with my eyes closed because then it helps me to go inward and it helps my facial muscles to relax more. Do it a couple more times and notice, is there anywhere in your body you're putting forceful effort? If so, go gentle, go lighter, and do less. If you're the kind of person that does a lot of effort, does more, kind of types hard, then you're especially the one that should go half as far as you think you should. And do less and do lighter. Okay, do one more and then take a pause. Just take a rest. If you happen to be sore after a Feldenkrais lesson or in pain, you're definitely doing too much. Take it down a notch. Go lighter, softer, or even just think through the motion. Okay, now we're going to coordinate the motion of sliding your left arm forward and back. So go ahead and slide it forward just about 1/2 inch forward past your right fingers. And as you do that, allow your head to gently roll into the pillow, to gently roll just a little bit to the right. And then slide your left arm back past your right wrist and allowing your head to turn in the direction of the ceiling. Slide your left arm forward. Your head goes slightly in the direction of the pillow. Exhale. Slide it back. The nose goes in the direction of the ceiling. Do this 3 more times. Slow, easy, making sure your head is being carried rather than you pushing it in that direction. Do 1 more. And then the next time you slide your left hand backwards, go ahead and slide it all the way up your arm, all the way across your chest, and go ahead and roll onto your back. Take the pillow away that's under your head and take a rest. Which shoulder blade is heavier into the ground now? Is there a difference in how your pelvic bones are making contact with the ground? If you're lying on the balance beam, which way would you fall off? Would you fall off to the right or to the left now? What's the difference in the length of your arms? How about the length of your legs? And just notice any other differences you feel. Perhaps go ahead and roll your head once to the right and once to the left. What's the difference now? Great. Go ahead and roll back onto that same side. Stack your arms and legs in the same direction, the same way. And this time we're going to let our head and arms be silent, and we're going to focus on our upper leg, so your left knee and leg. We're going to begin by sliding that knee just about 1/2 inch forward, but don't lift it. Make sure you slide it forward on the right knee. And as you go ahead and do this, ask yourself, where did I initiate that from? Did that movement initiate from the knee or from the pelvis? Or did you contract and hold in your core, your abdomen, as you did that? There's no right or wrong answer. All we're going for is the easiest and most effortless way to do this movement. Do it several times, just sliding that upper knee forward 1/2 inch and then back to the start. And as you do this, what is going on in your low back? Do you feel the individual vertebra rotating? Now, if you have low back pain, any kind of lumbar pain, you'll feel this for sure. And it may be good to go even smaller so you could really feel the individual vertebra moving one on top of the other. Okay, take a pause. Take a breath. And now we're going to go the other way with the knee. So if you want, you could think through this 1 or 2 times. And when you're ready, very gently slide your left knee backwards, but we're talking like 1/2 inch, so very small, and then back to the start. Do this a few times. Now notice if you're halting your breath. Sometimes when we learn a new motor act, we tend to halt our breath. So make sure your breathing is fluid. Make sure the movement is fluid as opposed to jerky. And do it one more time backwards, paying attention to what's happening in the individual vertebra of your back. And how high up your back and up your spine do you feel that? Take a pause. And now we're going to combine the 2 movements of sliding your upper knee forward and then sliding it back. So when you're ready, go ahead and slide it forward, come back to the start, and slide it back. Slide it forward, back to the start, and slide it back. Go small. Pause. Now, what we're going to do is we're going to coordinate the movement of your legs and your arms together. So the next time you go to slide your knee forward, go ahead and slide your upper arm forward along with it. Go ahead and do that. And then as you slide your knee backwards, then go ahead and allow your upper arm to slide backwards. Do that a few times. And to begin with, we'll let the head and neck remain stationary without being involved. You may feel a little bit of twisting and turning in your neck, but this is the involuntary movement. Okay, now pause. Now the next time you do this, go ahead and allow your head and neck to follow. So slide your arms and legs forward and then backwards. And as you slide it backwards, roll your head in the direction of the ceiling. Come back to the start. Go forward and back. Nice and easy, nice and soft. Do it a few more times. Go small, slow, easy. Okay, now come back to the start and take a pause. Now, what we're going to do next is we're going to go opposite with the arm and the leg. So let me talk you through this. I want you to visualize it once or twice before actually doing it. You're going to slide your upper knee forward, and then as it comes back to the start, you're going to slide your upper arm forward. As your knee slides forward, your arm slides back. As your arm slides forward, your knee slides back. When you're ready, go ahead and do this. Go small, slow. If you get tripped up or confused, just pause and do it all over again. The most important thing is that the movement is smooth and coordinated. Okay, take a pause. You're doing great. This is called differentiation, where we differentiate the movement of one part from another so that we could start to feel the individual movement of the vertebra. When we walk through the world, when we reach for a cup of water, we want all the vertebrae, all the ribs to move like links of a chain, each one individually as opposed to all held together like a block. This is the key to more efficient movement and decreasing overuse injuries and back pain. Okay, now the last thing we're going to do is we're going to go ahead and put it all together once again. And go ahead and allow your arm and your leg to slide forward and then to slide backwards. Go ahead and allow it to slide forward and roll your head to the right. Allow it to slide backwards and roll your head to the left, like you're rocking a baby. Just allowing yourself to rock. Do this a couple more times. And the next time you slide your arm and your leg back towards the left, go ahead and roll all the way onto your back. Make it lazy, make it easy, move the pillow out of the way, and take a rest on your back. And I want you to think through some of the same questions I asked you initially. I'll remind you. Notice which shoulder blade is more in contact with the ground, and what's the difference in the shape or the imprint they're making on the floor. What's the difference in how your ribs are lying? Is there any difference between the right side and the left side? How about your pelvic bone? How's the length of your arms? How's the length of your legs? Does something feel more released or more let go in half of your body? I mean, technically both sides of your body got the lesson because the right side of your body or the side of your body that was making more contact with the ground actually got a great deal of information. Okay, so take another moment here on your back, noticing any differences and changes, such as if you're lying on that balance beam, which way are you going to fall off now? And you could roll your head once to the right and once to the left. Is it easier to roll to one side? Do you have more range of motion, more freedom in your head and neck? Now, this is a one-sided lesson, but I encourage you to get up, walk around the room, and then come back and replay the same video, and you could do it on the other side. So the proper way to get up is to roll to either side. I'm going to roll to the left side, and I'm going to use my upper hand, my right hand, and my left arm to push myself up, like pushing these parts into the floor, and your head comes up last. So allow your head and neck to be carried up. Your head is the last thing to right as you're sitting all the way up. And then go ahead and stand and walk around the room. And notice the differences as you walk around. You're going to probably feel a lot of differences, a big shift. You may feel more asymmetric, but this lesson's actually about symmetry, which would mean you'd have to do the other side. And I'd love to hear your comments and your thoughts as to how your body feels after doing this lesson. If it's easier to turn, like if you're driving, to look at your rearview mirror, to turn your head and neck. This is great if you're a tennis player and you need to turn and twist, or if you're any sort of athlete, or if you're an office worker, or if you're just a person that wants to feel more comfort and more alignment in your body. That's all of us. So thank you once again for joining me here today.